like cramps in pregnancy are normal. In these videos, we are going to talk about dealing with cramps. Tips that will help you. And in the description, I will leave other links for other important videos. It can happen in almost half of pregnant women. This problem is characterized by a sudden contraction, with intense pain, being more common in the legs, arms or belly. However, it can appear in any muscle of the body. Like cramps are sudden, intense and involuntary contractions of the leg muscles. They are frequent in pregnancy, especially in the third trimester. They are painful and can interfere with daily activities, interrupt sleep and reduce the quality of life of pregnant women. Several treatments have been proposed to treat cramps in pregnant women, including medicines, vitamins, and minerals, magnesium, calcium, sodium, and other types of treatments, such as muscle stretching. Cramps are more common in the last trimester of pregnancy and can have several causes, the most common of which are associated with metabolic changes in pregnancy, physical inactivity or excessive exercise, dysregulation in the content of electrolytes in the blood, such as magnesium, calcium, and sodium, or vitamin deficiency, such as D and E. To alleviate this problem, it is recommended to perform stretching techniques, massage and apply warm water compresses, as well as to practice physical exercises in a moderate and regular way, such as for 30 minutes to 1 hour for 3 to 5 days a week. It is also important to maintain a balanced diet, rich in water, fruits, vegetables, and seeds. The main way to relieve cramps that arise during pregnancy is to stretch the affected muscle, just as they happen, pulling the muscle in the opposite direction to the contraction. Thus, when the cramp happens in the calf, one can sit with the legs straight and try to pull the foot towards the groin. When the cramp happens in the belly, which is very common, since the weight of the uterus can compress the nerves and muscles of the region, stretching can be done by lying on 2 pillows, located on the back, and stretching the arms. Right after the cramp, it is important to stretch, massage the muscle and place a compress of warm water on the painful area. Some tips to relieve cramps on how to treat pregnancy cramps. In some cases, it may be necessary to treat the cramps with medications, such as magnesium, which should only be used with a doctor's prescription. How to prevent cramps. Some tips that should be followed to prevent cramp episodes in pregnancy are: do daily stretches, as it helps to give flexibility and correct changes in posture. Practice light to moderate physical activities, such as walking, for about 30 minutes a day, for 3 to 5 days a week, as they improve strength, elasticity, and circulation in the muscles. Avoid excessive exercise, as intense and exhausting activities can also trigger fatigue and sudden muscle contractions. Drink about 1.5 to 2 liters of water per day. Keeping your body hydrated, eat a diet rich in calcium, potassium, and magnesium, present in foods such as avocado, orange juice, bananas, milk, broccoli, pumpkin seeds, almonds, hazelnuts or Brazil nuts, for example. Although these foods are rich in minerals that help to prevent cramps, it may be necessary to take supplements rich in these minerals, which should only be taken by the pregnant women when indicated by the doctor.